Great, good morning. My name is Linda Tiemann. I'm the Executive Director for the Washington Center for Nursing, and we are happy to see you all on this rainy day, at least west of the mountains here. I will ask first that our colleagues across the state make sure that you mute your mics and only turn them on when you're asking a question. I want to welcome our guests here at Shoreline. I see people are continuing to come in. And at least for people here, I'll tell you there is breakfast in the back, and coffee and tea, and please help yourself. And I want to welcome everyone at our sites across the state for this conversation about educational progression in nursing. For the rest of you, I'll tell you we have sites joining us at Bellingham Technical College, Clark College, Clover Park Technical College, Columbia Basin College, Grays Harbor College, Peninsula College, Spokane Community College, Walla Walla Community College, Wenatchee Valley College, and we have a special site at Olympia for the Department of Health employees down there. And then here we've got a nice crowd at the Shoreline Health Department Laboratories. We want to thank especially Mindy Schaffner from the Nursing Care Quality Assurance Commission for her excellence in orchestrating this event, to the staff from the Center for Nursing who are out in the hallway, to our hosts here at the Shoreline office, and to our presenters, Donna Meyer, who's president of the National Organization for Associate Degree Nursing, and Dr. Susan Hassmiller, who's the senior advisor for nursing for the Robert Wood Johnson Foundation and the director of the National Campaign for Action. I want to thank you all for investing your time in this important conversation. In your emails or in your packets here, you've received the agenda, the bios for both of our speakers, and their handouts. This event is being videoed professionally and will be posted on our website later today for reviewing and for sharing. It will also be posted on the National Campaign for Action website so that folks outside of Washington can see this. Again, please keep your mics muted. We'll ask you to turn it on, of course, when you have a question. And when you do ask a question, if you would identify yourself and your home organization, that would be helpful to all of us. If necessary, we'll repeat the question so everyone can hear it, so the questions and the answers match. So I want to get out of your way, be brief and be seated. And first, let's hear from Donna Meyer.
Good morning, and first of all, it is a pleasure for me to be here today to talk to the state of Washington, wherever you all may be. I just wanted to, I know you have my bio, but I just wanted to mention a little bit that I have been involved in associate degree education for about 35 years now. So I have been both a nurse educator, then became a director of the nursing program, and then became a dean. And presently, as you know, I'm president of the National Organization for Associate Degree Nursing. And one of the things that I have found as I've traveled the country is that people do not know about our organization and the work that we're doing to progress academic progression in this country and to work with some of the major partners on this initiative. And we think it's extremely important. And so my presentation is going to be talking a little bit about our organization, the work that we're doing partnering together across this country. So again, it's a real pleasure for me. I've met some of the people from Washington as I've traveled to different activities across this country. And so I'm going to just start. Let's see here. Okay, they're going to get the PowerPoint up, some of the information here. All right. First of all, I do want to mention, and I'm not going to read things like the mission and our goals, but I think it's important for everybody here to know, we are the only organization in this country that works solely for our associate degree education. We do work closely with the National League of Nursing, of course, who represents all levels of education, but we work solely for community college nursing. And of course, right now in our country, this is so very important because of the fact that still, in the latest HRSA data that came out in 2013, 60% of the people that are going into the nursing profession are still beginning at the community college. However, we believe it's imperative that for the healthcare of this country, that those students continue their education once they graduate from a community college. So that's what our major focus has been in the last. And these are some of the goals. We, of course, not only want to work on education, but because education comes with practice. So we're very, trying to be innovative on practice, especially with our students when they're in the programs. How can we create different clinical sites? We have to start thinking about that as educators because healthcare is changing, as you all know. And, no longer do we need to keep thinking about that acute care setting. We need to think about community settings and all those different types of settings. So part of our goal right now is to work with educators in community colleges to help them be creative and innovative, thinking about other areas that you can create for practice. Because what we hear as we travel the country, myself and the board of directors, we can't get clinical placements. Well, maybe we need to think about different things. I kind of have my foot in both areas because of the fact that I'm doing this as the president, but I'm also still an educator, and I'm still working with my students on a daily basis. So we have, we go to Head Start, we go to much more long-term care, we're in, the public health department, just so many different areas. So I think we have to begin to think about that. I want to talk a little bit about how we are advocating for community college nursing programs throughout the country. First of all, we do have a board of directors, and they're an elected board of directors, and we actually travel to Capitol Hill at least once a year. So we are out there talking to legislators, saying we are here to communicate with everyone about the work that community colleges are doing and how we are partnering with clinical practice partners, with universities, and that we need funding for nursing education, and we need funding for people to go on to continue their education, whether it be for a master's to be an educator, for advanced practice nurses. We're not just solely focused when we travel to Capitol Hill to talk just about nursing education, but we're also talking about healthcare, because it is vital. We understand we need a nurse anesthetist, we need advanced practice nurses. So we talk about those kinds of things. And so I want people to understand that this is a national organization that's working very hard with our community colleges, but also we're working by partnering. One of the things that we did a couple years ago, which I think shows the importance of this organization, is that we became a member of the Institute of Medicine's Forum on Innovation for Interprofessional Health Education. As you all know, this is the new thing that's been developing in the last couple of years, interprofessional education. What's interesting about this in the Institute of Medicine Forum that we on, and I'm the representative for the national organization, and I can tell you that there's other major organizations, RWJF, NLN, AACN. However, we are the only voice for community college on this panel. And it's, again, and there's about 47 members from all over the world. So it's an extremely interesting, innovative forum. We're talking about interprofessional education. And what's interesting is originally we were not on the panel I think people that have gotten to know me and our organization, we're not shy about trying to figure out how we can partner. We're not in a silo, we're here to partner. So I actually approached the person in charge of this as far as the Institute of Medicine and said, with so many people, 48% of the country now begins their education at community college. We need to have community colleges learn about interprofessional education. You can't wait till they've gotten to the university because so many of us have programs, dental hygiene, EMT, paramedicine, occupational therapy, surge tech, the list goes on, you all know that. So we need to start that. And so it's been a wonderful experience, and I can tell you that next May we're having I'm on the planning committee for a 2-day workshop on this specifically, talking about community colleges and working together on interprofessional education. So I think it's really important that we get that word out because this is a new way. We also got involved in the Joining Forces initiative, which I think many of you know about, that Dr. Jill Biden and First Lady Michelle Obama were very emphatic on having this initiative. And We are a part of that. It's on our website. We've encouraged our schools to get involved in this campaign to educate the future nurses about working with our veterans and all the issues that they may face. So I think, again, this shows that we're, there at the national level. This just was a picture of us. There was 65 of us at the University of Pennsylvania a year ago, April, at their School of Nursing, and just kind of shows. Also, we were invited to participate in a White House conference about nursing education and practice. Again, I want to emphasize, yes, we're here for education, but we also want to be involved in practice. And so we were very excited because so many of our students are going on to become nurse practitioners, so we feel it's really important that we talk about that. There's also the Million Hearts Initiative. This is a major initiative out of the CDC that we've been working with as far as educating the public about blood pressure and stroke prevention and all of that. Again, this is all on our website because we're educating the future nurses about this. I just wanted to show a few of those things to let you all know the things that we're involved in at the national level, and there's more, but those are some of the highlights. I want to talk about, I think, one of the most historical things that happened as far as I'm concerned since I've been involved in nursing. And that is the academic progression statement that was signed. It was actually signed and released on September 18th of 2012, and that date is embedded in my mind, just because I think it was really important. What's really, I think, is exciting about this, that we all met for the first time in July of 2012. And the exact date was July 18th. So 3 months to the day, we were able to come to some discussions. And these major organizations, the American Association of Community College, headed by Dr. Walter Bumpus, the Association of Community College Trustees, headed by Noah Brown, the organization, the NLN, of course, headed by Dr. Bev Malone, and the AACN, headed by Dr. Polly Bednash. We sat down and we said, how can we move academic progression forward in this country? And obviously, we came to the consensus that we all need to say and show that we're working together. And so we have the academic progression statement was released on September 18th. And to me, that was a historical point in nursing because I understand that in the state of Washington, you all work very well together, and I think that's wonderful, and I commend all of you for working so well together. But it's not like that in every part of the country. And so I think we wanted to show that we are working together, we are partners, and that it's imperative for the healthcare of this country that we are partners. We should not be in silos. We never should have been. And we want to be the leaders in working with some of the other national organizations on this. We continue to work together. One of the other initiatives that we've been involved in is APIN, the Academic Progression and Nursing Advisory Committee. I do sit on that committee, and it was a real pleasure to be involved in the reviewing of the APIN grants and the 9 that were awarded. That was an exciting time. And I think, again, this shows, when Dr. Sue Hassmiller approached me about this, I said, of course. I mean, there was no hesitation because we have to show that we're working together. And so this is another initiative that we are involved in. One of the things that I thought was important, too, is that we continue to, you can't have discussions just every once in a while. You have to continue them. And so our board of directors we actually decided in January of last year that we wanted to have a roundtable discussion with the nursing leadership of this country. So we all went to Washington, D.C., and we had a roundtable discussion, and it was wonderful. Some of the representatives there, of course, you can see, not only did we have our previous partners, but we added some partners. So we had the American Nurses Association, Dr. Marla Weston. Pam Thompson from the American Organization of Nurse Execs was not able to be there, but Tina Girardi, who works closely with the APEN project, was there, and of course was wonderful. And then also Mary Sue Gorski and Pat Polanski were some of the people. Oops, sorry. Can I go back? Oh, sorry. I didn't want to get to that one yet. I thought that. So it was a wonderful, honest discussion, and we talked about some of the issues confronting nursing. You know, the board of directors from NOADN, they're all educators right now. Many of them, some of the board of directors are not deans or directors, they're faculty. And so they talked about some of the issues about ADN nurses not being able to get positions right now in employment settings. They talked about the clinical, and we did some wonderful brainstorming, and I think it was a wonderful experience because, again, it shows, and what I want to tell all of you, that both from the practice side, the community college side, the university side, we're all working together, and we want to continue that, and any help that we can give in any state, we would be happy to do that. Whoops, sorry. Okay. I also want to talk a little bit, the Robert Wood Johnson Foundation, and I'm sure, I don't know if Sue will mention this or not, but they convened a meeting of community college presidents. Now, it was a small group of community college presidents because, of course, there's about 1,200 community colleges in this country. But it was a representation of both large and small, rural and urban, and it was held in D.C., and it was along with many other partners. You know, the Tri-Council was present, NOADN was present, AACC, ACCT, all the, you know, it was just a really frank discussion about some of the, and these are the kind of the things that we talked about at this particular meeting. And we wanted to really find out, you know, issues that the community college presidents are concerned about. And one of the things, and I know this was mentioned at the meeting, it was noted, it's emphatically stated by Sue all the time, and Dr. John Lumpkins from RWJF mentioned it, there is still this notion about closing community colleges, and that is not there. That is not the initiative of the IOM Future of Nursing. It never was. It never will be. I mean, community colleges are needed in this country. I mean, looking at a state like Washington, when it's, you know, there are some rural areas. I'm from Illinois, and there is more to Chicago more than Illinois. Everybody thinks, oh, you're from Chicago. No, not really. I'm actually from Edwardsville, Illinois, which is very close to St. Louis. But what's interesting is I understand rural populations because our community college serves a very rural district, and some of our students actually have to take a ferry to get to school. Some of them have maybe dial-up access. So, you know, those are some of the issues that we have to think about when we think about academic progression. I was in North Carolina this summer, and that was one of their issues. You know, in order for the students, once they graduated, to go back to school, they had to come back to the community college to get access. So I think some of those issues, and I think that's one of the things that we understand and we want to work towards. So this was a really wonderful meeting, some very good discussion. We're hopeful that we're working on a white paper that we're going to hopefully get out to all of you very soon. I can tell you that it talks about the importance of community colleges. It talks about some of the barriers that are there, but yet I don't look at things as barriers. I look at those things as opportunities. The barriers, you know, to me is a kind of I'd like to say a foreign word. I'd like to say that those are opportunities, and we can work on those opportunities together to make the healthcare of this country a much better healthcare. And so I think it's exciting that we're able to do this. We have some wonderful partners, and I think people do not realize sometimes that this National Organization for Community College Nursing Program, we're out there constantly talking about partnering. The first I want to mention is the American Association of Colleges of Nursing. We did produce a joint brochure, and I have it, and it's in your packets, and this joint brochure was all about academic progression. I think it's pretty powerful that the fact that the two organizations on it are the American Association of Colleges of Nursing and the National Organization for Associate Degree Nursing. I can tell you that 10 years ago, I don't think this would have happened. And I commend Dr. Polly Bednash, and who helped and said, yes, let's do this, and also Suzanne Miyamoto, who works with them. She has been instrumental in helping moving things forward. The other thing I want to mention is that we had webinars on academic progression. They were well attended, and again, a partnership. The other thing is Dr. Pally Bednash has invited me to their conferences when they have conferences for their deans and directors. And I will be honest and say the first time I went, I was a little bit nervous. I thought, I'm going to be the only community college person there. I'm not sure. And I have to commend, and I know there's university people here and elsewhere in the state listening this morning. When she introduced me at the conference, the applause was amazing. They came up to me and said, "We're so glad you're here. Why haven't we done this in the past?" So I think that just shows where we've been and where we're going. And that's what we have to continue to do. And so I commend these partners because we're working together. The National League for Nursing, I have a conference call monthly with Dr. Bev Malone. I'm always a joint conference attendee. We have a booth there talking about how we're working together. And also we've been working on some grants together. And the other thing I wanted to mention with the National League for Nursing, obviously, I'm not sure if I really want to bring it up, but there's a lot of issues around accreditation right now. But I do want you to know that when I do get concerns, because I have sent those to Dr. Bev Malone, and she answers everyone. So I'm not really here to talk about all the issues because NOADN does not, we're not involved in accreditation except to say we support accreditation and think all community colleges should be accredited. We will definitely go on record to say that. But as far as getting into some of the issues, we're not. Of course, we partner with our WJF and ARP in the future of nursing because we feel it's extremely important that we work together. I was asked to present to the National Advisory Board last October. I was flown into Washington, D.C., and that was a really wonderful experience because, again, some of the issues that I brought up, they said, oh, we forget sometimes about some of the things and some of the opportunities out there that we have to address and that. Of course, I always attend the Future of Nursing National Meeting. We are a Champion Nursing Council member and work together. I recently presented in Chicago at the Action Coalition Education Meeting. I think the more we can see the National Organization of Associate Degree Nursing working with the campaign and showing how we believe in the Institute of Medicine Future of Nursing report, we believe that it's imperative for this country, and that is something that the national organization will always go on record as saying, is that we feel this is extremely important. We also are involved with the nursing community. The nursing community actually comes out of Washington, D.C., and there's about 58 organizations involved in the nursing community, and we feel it's very important that we're working together with them. We also work, of course, with the American Association of Community Colleges. We are an affiliated council. However, what I do always want to emphasize, we are our own separate organization. Sometimes people have thought that we were part of the AACC. We are not. We have our own board. We have obviously a president on down, and we work very closely with a management company. But we are our separate organization, although we are an affiliated council. I sit on the Workforce Commission for AACC, which is extremely important because there's a lot of education to do with community college presidents, I've found. So, and usually, just talking to them about nursing and academic progression. And I do think, I have to honestly say, being at a community college and working extremely closely with the president that oversees our college and the board of trustees, a lot of times there's still that fear of community college nursing programs going away. And nursing to community colleges is extremely important. It's important to those communities, and it's important to those presidents. And so, you have to look at both sides of the coin sometimes and understand somewhat where they're coming from, that they may be fearful that their programs are going to be closed or somehow eliminated. And so I think we have to continue to educate them and understand, help them understand that we're really working together. And I think in nursing, we haven't maybe in the past done that as well, but we are doing it now. I do many presentations at their national conference. I was in April, I did one the last 2 years. We're an exhibitor. attend their fall meetings, workforce commission meetings. So we're there trying to educate the community college presidents. We work closely, very closely, with the Association of Community College Trustees. Their big convention is here in Seattle right now. The opening is today, and actually tomorrow morning there'll be a spotlight session with Dr. Sue Hassmiller, Dr. Bev Malone, and Dr. Polly Bednash. So all four of us up as a panel saying how we're working together, and I think that will speak volumes. This is a very large convention. Presidents come, trustees come, and I'm fortunate enough that Jean Torgensen, who is on our board as our public board member for NOADN, she is actually the chair of ACCT and is a nurse and an associate degree graduate nurse. So she has been a true breath of fresh air to have on our board and also to work with ACCT. And I also have to commend Noah Brown, who is the CEO of ACCT. I've worked with Noah for probably the last 4 or 5 years, even before I became president of NOADN. And actually, it was right here in Seattle when we started our partnership. I think it was at the bar in the Sheraton Hotel, actually, over a glass of wine one night. But honestly, he said, I need somebody that's going to help me understand nursing. He said, but I need somebody who's going to help me understand it from both sides of the coin. And so we started talking, and, I was always about academic progression and moving nursing forward. And, originally I'm a baccalaureate grad, and so I kind of began to understand both sides because I went to a community college and started teaching, and obviously I never left. And so but I honestly have to say he is wonderful, and he is trying very hard in this country to talk about the importance of nursing and how. And I think this is just somewhat of a, maybe it's hard to see, but I just think it kind of puts it all together, how we really are working across this country and moving things forward in nursing. I think it's extremely important. Lots of national presentations. What I'm always still finding is that people don't know about us. They don't know there's a national organization for associate degree nursing. And so I've been, across talking to lots of different, now some states do have chapters. I know Washington does not, but I've heard from my community college friends and colleagues this morning that's going to change, so that's exciting. We actually have about 500 community college members, and there's about 965 community college nursing programs in the country. So we still have our work cut out for us. I think what's happened is that we are a young organization when you think about it. 27 years isn't, when you compare us to NLN and ACN and ANA, we're still young. We also are a volunteer organization. We are thinking in the next years of changing that somewhat, and we're looking at that as far as having more of an executive director type position. We need to start looking at that. But I've been very blessed because I work at a college where my president says, just go. You need to do this for nursing in this country. So I'm basically gone 2 weeks out of the month from my dean job, but we all work all hours and nights, so it works. But so these are all the different presentations that we've been trying, I've been going about doing and trying to get people that aren't possibly chapters. We do have Illinois' chapter in Missouri, but I went to California last February, spoke to all their deans and directors, and they're working very hard. So it's just, I think when I stand up, I always say I'm here to represent all community college nursing programs. So even if, someone is not a member, I'm still going to stand up and, say we advocate for all of you and we're here. But obviously, it's wonderful to have the membership, too, because it's extremely important, I think, for us to say, this is a powerful organization, and we are here to address those concerns, and the more we have our membership, the more I can hear from all of you. I wanted to just talk a little bit. I know, it's important for me. People say, well, why should we be members of the National Organization of Associate Degree Nursing? Many are members of NLN, and which represents us. But again, I want to emphasize we're only here for working hard for community college. We also have some other amazing things aside from the fact that we have a National Honor Society. It's called Alpha Delta Nu, ADN, Alpha Delta Nu. And it is the only honor society for community college nursing students in this country. And we started it about a year ago, and we now have about 65 chapters. The community college does have to be an agency member to start a chapter, but it's wonderful for our students because, you know, obviously baccalaureate programs and higher ed have Sigma Theta Tau. And of course, they have Phi Theta Kappa, but it's not just for nursing. And the students are so proud. I can tell you from having a chapter, you know, they have the peach cord they wear, they have their pin, and they're so proud when they go to graduation to say, and you know, that they have this honor society now. So it's wonderful. We have our own journal. It's produced by Elsevier. It's a wonderful journal, and people love it. And those of you that are looking to publish, great place, Nursing Educator, think about it. We have our national convention, which is in Reno this year. It's a wonderful convention, usually about, I'd say, 500 attendees, but it's very, you know, Dr. Susan Reinhardt is our keynote this year. So she'll be talking about the campaign and probably, you know, about how we're working together. The webinars, we have a wonderful listserv that I think is really beneficial because you'd be surprised the questions that come out on that listserv. They'll ask about, you know, things like, you know, what other kinds of pediatric clinical experiences are you all doing? How are you evaluating students? Are you, you know, just so many questions. And it's so good for nursing educators to communicate. So it's been a wonderful resource. This talks about our honor society and that there's 63 officially chartered chapters now. So we are definitely growing in numbers. And then finally, I just wanted to mention our big convention that we have. But what I really I just, you know, wanted to talk a little bit about NOADN specifically. But I want to emphasize, and I want everyone to know that's listening today, that we are working extremely closely with all of the national partners and specifically with the campaign. We believe it is imperative for this country that nurses continue their education. Yes, there is the goal of 80-20, and we are here to work together to meet that goal. And we will do everything in our power to help meet that goal because we think it's imperative. One of the things that we're working on too is associate degree to master's programs. We feel that that would be very beneficial. There's about 173 now in the country, and that seems to be growing. That number could be off right now. It could be more than that, but it was 173 according to AACN, who helps me with the data. But we feel that would be another really strong imperative. Of course, community colleges, some beginning to offer the BSN on their campus or the continuation. We support that. We support any means to help our graduates continue their education. And we think it's just so very, very important for the country. And I just think it's been a really wonderful experience because nursing should have done this many years ago. It's taken us a while, and so of course I think the Future of Nursing report pushed us in that direction. And I think that is wonderful that that happened, and we are here to support it in every way we can. So I just really, right now, I was hoping to have questions about, you know, I think that's really what I want to say, is that we are here to work with community colleges, universities, however we can help, and that we are here to support this campaign, and we are working, and we are being recognized as national leaders because it is important. And community colleges are here to stay. They are the pipeline, and we do have opportunities facing us, and we will take those opportunities and work together. So, I am. Yeah, I think so. I'd rather have more question time than talking head time.
Do we have any questions here?
Goodness.
Please identify yourself and
our comments. It could be a comment too. Doesn't have to be a question.
Mary Baroni
Yes.
from the University of Washington, Bothell, and we're just really thrilled that you're here. Wonderful words, and I think it's just such the right time to be doing this. I really appreciated what you said about the first time you went to an AACN meeting. And I've been watching your website, I've been looking at your journal, and I'm wondering, is the reverse also possible? And what is the reception to non-ADN faculty participating in your organization?
We would welcome, we welcome anyone. And I will tell you that, one of the things I want to mention is we always invite AACN to come to our conference. I'm glad you brought that up because, and I have to say, again, Dr. Polly Bednash has been wonderful about making sure someone is there because sometimes she cannot do it. But for example, in New Orleans, the dean from Loyola came. The dean this time is coming from Nevada, from the University of Nevada is coming to Reno, Patsy. And so we always welcome them, and we are actually thinking about some other new partnerships, but I think that's a really good thing. And again, that's why we're doing, like tomorrow, even though it's at ACCT, I think showing us all together works really well. But yes, we do invite them to come, and they have been very receptive to coming or making sure they have a representative there. So that's a really good thing. I want to tell you a little story too about what happened with AACN last year in October. If you remember last year in October, Hurricane Sandy hit. And that was at the time of the AACN meeting at the JW Marriott, and none of us could leave. We were captured there, I guess you could say, and it was unfortunate for the people on the East Coast with Sandy, and I'm certainly not making light of it, but I can tell you about a very positive thing that came out of it. I'm from Illinois, and Illinois is one of those areas where we haven't always worked real well together. I will be honest, and they know I'm going to say this, so it's okay. But there was deans and directors there from Illinois, and they took me under their wing, and again, we didn't have any place to go except the JW Marriott, so we'd sit there at night, and they were bringing food in, and I said to one of the deans, I said, Vicki, why don't we ever meet together? We have never, ever met together in the state of Illinois, because there was a big push in Illinois for BSN in 10, and that was really being divisive. And so she said, I don't know. Well, you know what? We met together last February, and we just met together last Thursday and Friday. And in fact, on Thursday night, the two deans one from ISU and one from Illinois Wesleyan, opened their home. We had a wonderful social time, and we are moving by leaps and bounds. And it's because we all got together. The BSN in 10 is off the table. And really, they asked me last September to actually present and why we were opposed to that. And I said, because we're working together right now. And I said, there's so many different things. And I said, let's try it this way first. And they listened. And I think for the community college people in Illinois, and there's 48 community colleges and 27 BSN, they really felt it was important to work together and not have some type of legislative move. And I know there's a lot of controversy about the legislation, but, and I think that was one thing. And now it was fun last week. It was fun. We are having a great time together. Our State Action Coalition is moving forward. And I think that's one thing I wanted to mention. In all of the states, wherever we have NOADN members, they are on those action coalitions. I have board of directors that are in Louisiana, in Florida. So NOADN is trying really hard to make sure we have representation on the action coalitions in each state so that we are there to move things forward from that aspect. So I appreciate your comment, and I think I was supposed to repeat that comment, and I forgot to so the rest of it could hear. But it was basically about working together, and are we asking AACN and the baccalaureate people to be present too, I think is part of it. And we are looking at other ways we can partner. So thanks, Mary.
Just kind of going along with that.
Could you identify yourself?
Oh, I'm sorry. I'm Mindy Schaffner with the Nursing Commission.
Uh-huh.
And kind of going along with that, I really tuned into your Alpha Delta Nu
Mhm.
because I'm really involved with Sigma Theta Tau.
Okay,
Has
yeah.
there been a connection between?
Well, you know,
those
it's
different-
interesting, they did call the national office, and I think we're gonna follow up, and that was just recently to see, so I think that might be a new partnership, our discussions that we have. We were fairly new with this, and I think they're pretty interested in the fact that we've done this, so I do believe, it's one of the things I have to work on and follow up on, but they did just recently call the national office, so yes. So hopefully, just for all of you at the satellites, the question was about partnering possibly with Sigma Theta Tau, or any discussions with them, since we do now have our honor society. Yeah, great, Mindy, thank you.
My name is Emily Storman. I'm a new graduate associate degree clerk student.
Mhm.
And I'm just wondering what benefits we can expect to see with 80% of nurses having a bachelor's degree as opposed to an associate's degree. And how can schools and employers help associate degree nurses reach that goal?
Could you repeat that question?
Yeah, well, I can try. It was a two-point question. I think the question was somewhat the benefit of the 80-20, and also how can employers assist associate degree graduates, is that correct? I do believe Dr. Sue Hassmiller is going to kind of go over some of that in her presentation. I will also comment, somewhat as far as one of the things I do want to comment. I know we have practice people, and I honestly am not sure exactly in Washington what's happening, but because I have to have the national view, one of the concerns, I'm going to start with the question about employment and helping students go on. I think one of the things is I truly understand like magnet status and people wanting to have more baccalaureates. But I think we also have to be very careful about only employing baccalaureates and not employing associate degree and encouraging them to go on. I think there needs to be a mix, and that's NOADN's viewpoint, because we're concerned if associate degree graduates cannot get employment, they will leave nursing. And we then, in a few years, could be, obviously, there's a lot of us around my age that someday might retire. We don't know if we'll ever retire, but possibly. And if we do, we need that next generation of nurses. And so we understand from an employment that, having students go on, or graduates go on, there might be tuition reimbursement, it might, be costly. But I think we really need to figure that piece out so that we can still employ associate degree graduates and encourage them to go on. And, I know there's employers that are having people sign something that says within 5 years. No, that's okay. That's not our role. We, if that's what an employer in the practice setting feels they need to do, we understand that. But I think our message as a national organization for community college nursing programs is that we would like to say to the practice people, we really would hope that you would consider hiring a mix of individuals so that people can go on and we don't in some years end up with an issue where people have left nursing that had a wonderful nursing education. The other thing, the next question you had about what is the benefit of the 80-20. Having been involved in nursing for many years, the nursing profession and the needs of the individuals in this country has changed drastically. I think, and when I say I'm speaking for the national organization, we believe that our education at the community college level is excellent. We do educate a wonderful practitioner, but I don't think there's a profession in this country that shouldn't have further education. And whether it be, I'm talking, I'm in a college that has a welding program. We have people come back to school. I think it's imperative. I can tell you when I went to school, I was taking care of people who were in the hospital for 3 and 4 days for GI series. That was like didn't require the type of care that is happening now. The other issue about the 80-20 is because healthcare is changing and there's so much emphasis on wellness and prevention, which, wow, that's a wonderful idea. That's maybe where we should have started some years ago. I think you have to have so much education, and I think, you know, in a community college we are integrating community health in our curriculum, but we believe that, you know, continuing on so that we can have a more educated workforce will not hurt anyone. I mean, more education is really a very good thing, I think. And so we do support it for a variety of reasons. And also, the reason we support it, you know, I think a lot of emphasis has been put on the 80-20 with the BSN. We don't have academic progression. Like I say to the community college presidents, you might not have a program because you won't have faculty. So when I think of 80-20, yes, I think about BSN, but I go further than that. We've got to think about the doctoral prepared. We've got to think about the advanced practice nurse. We've got to think about the nursing faculty. So I think sometimes the emphasis is being placed so much on that, where we need to think about academic progression, period, and the faculty issue. And I can tell you, I also run a nurse-managed center. We have a clinic, and I'm really proud to say we're the only nurse-managed center in the country at a community college. We see, in the last 6 years, we've seen about 105,000 patients. And I can tell you it's a real struggle sometimes for me to get a nurse practitioner. I mean, I have 3 that are faculty and have a faculty practice arrangement. But it's a struggle because we're in somewhat of a rural area. We can't pay the nurse practitioner maybe what we'd like to at times because we are in an academic setting still, which is, of course, another issue. But I'm just saying, we need that advanced practice nurse too, because that advanced practice nurse is serving a dual role. Not only is she helping educate 285 nursing students that rotate through that clinic, but she's also seeing patients. So I guess one of the messages would be the 80-20 is extremely important. I will always say that. But I think academic progression is the key message that we really want to send, because of the fact that we need those nurse educators. We need them at the community colleges, and we need them at the universities. And I also have been a site visitor, an NLNAC site visitor, now ACEN. But I can tell you that, I went to some schools in very remote areas, and it's been very difficult for them to have master's prepared faculty, which you must have. And, I think we need to continue to move in that vein for that reason, so we can have excellent community college programs like we always have had and will continue to have. Yes?
I just wanted to address the support issue that you had asked about.
Mhm.
Could you identify yourself?
I'm Robin Fleming with the Washington State Nursing Association, and so we also are partners in this process
Mhm.
and very much support the educational advancement of nurses. And so nurses with ADNs who are looking to get additional education, we do have a foundation that provides scholarships for that. If you're looking for financial support,
Good.
we are one of probably
Right.
many organizations that
Right.
can help provide you with that.
Right. And I have to mention that the National Organization for Associate Degrees, we have a foundation also. And we not only support students, we have a couple students if your school's a member, but we also support our members who are working on their doctorate or their master's. We have scholarships available, and so we also do have a very wonderful foundation arm too. So we do, provide scholarships. And I know a lot of our chapters also, I know in Illinois, our chapter provides scholarships not only to students, but also to individuals who are working on either their master's or doctoral degrees.
Let's see if there are questions we can just ask.
Does anybody have any questions at the satellite sites?
Is there a question somewhere?
Comment?
Hello. Hello, can you hear me?
Yes, can you identify
This is
yourself?
Clark. Yes, my name is Terry Nosat, Clark College, Vancouver, Washington, and thank you for this program, it's great.
I'm just curious, on a national scene, when we're talking academic progression, what do you see when you go out and see different states and their ADN programs? What kind of student success and retention support is available in the schools to help the ADN students themselves progress through the program and succeed and graduate?
That's a very good question, and I will repeat it just in case. It was more, I think everybody hear that okay? All right, this time. Okay, so I think what I am seeing is many of, and again, I chime in for the associate degree people here, but most of the schools have some type of a learning specialist to maybe help the nursing students be more successful if they, are struggling. Somebody that's really, maybe it's, I don't like to use the word tutor as much. I like to learn, more somebody like a learning specialist, but somebody to work with those students to see what areas they need assistance in. I think most of the nursing programs have worked on retention a lot in making those students successful, and I think most of it has been through things such as having a retention specialist, having some type of standardized testing program so that they know ahead of time if a student's struggling in a certain area, let's get some assistance right away. Some of these schools, I think, have even changed like their admission criteria so that the student can be more, look at the student coming in. Other things have been looking at maybe their prereqs, other issues. What is their grading scale in the School of Nursing? Some schools have raised their grading scale a little bit more. So I think there's a lot of different ways they're helping students be more successful, but I think the one I have found more predominantly across the nation is a specific learning specialist, retention specialist, remediation, whatever you want to call it, for the nursing program. And sometimes in the smaller programs it might be a faculty member, or they're, the faculty members working with the students a little bit, but I would say that's probably the biggest. And I would, maybe here in Washington, I'm not sure what else you're doing, but there's different things, but that's exactly what they're doing. I think the retention specialist is the big one. And if you're an accredited program, that's one of the questions you're asked is really your attrition, your attrition or retention, however you want to look at it. You have to really address that issue, and that's a very important issue, I think. The other thing I just want to mention in the community colleges, it's interesting, we're seeing so many more second degree students come back. And I'm sure you are seeing that too. So, and I, actually try to sit down with those second degree students, because depending on what their, past has been, I will try to send them maybe to an accelerated program to get the BSN, or if there's some other means. So I think that's another thing that, we have to do, to help students make the right decision. And this is a little bit, one of the things when I mentioned that, one of the strategies that we've been doing as far as academic progression, and I know some schools do this, but we start when the students are being oriented to the nursing program. We have a formal orientation once they've been accepted. And so what is happening now is the dean from the university comes to that orientation, and we stand side by side and say, this is your first step in your nursing education, and here's your next step, standing next to me. No, and it really, I just think it helps. We offer the pathophysiology course on our campus, which is one of the bridge classes. So, I know everybody's doing something different, but I think it's a messaging is extremely important. Showing that we're working together and we're not working in silos. And, there's so many things. We have a joint brochure together with our school and, the university, showing the path for them. So they have it from day one. And I think those kinds of things can be very helpful. And I think, across the country we need to do more of those things. So students feel very accepted and very wanted. And they want to do it. They want to go on. I think that's part of it. What made some of us go on? We have to do that same kind of thing to encourage students to go on.
Do
Yes. Well, as far as, oh, sure. The question, Steve from the University of Washington is asking about different models, like how our organization supports like our articulation models, just different models, and the Oregon model. What our organization says is we support anything with academic progression. I mean, and it depends on everything, it works different for every state, I have to honestly say. I mean, North Carolina went with a common curriculum. I know in Illinois, that's what we're working on somewhat, is having, more. But I think it's hard to do something nationally because you have different boards, like the higher ed board or the community college board, and what's required in one state might be required something different. But I think, one of the things that we have found helpful, of course, is having those universities and those community college, and sometimes depending on the size of the state, it might be more regional, where they sit down together and look at those curriculums and say, okay, this will work or that won't work. I think one of the things that our organization will always say is we don't want students to have to repeat anything. And I think everybody's finally in agreement of that, but there's still some of that out there. I know one of the courses, we have a health assessment course in our curriculum, which is a little different. Not all community college programs have a health assessment course. And so we've had to have some very serious discussions in the state of Illinois about taking that health assessment course because it's usually taught in a baccalaureate program. And so sitting down, showing the syllabus, saying, hey, it's taught by nurse practitioners, those kinds of things. So I think, honestly, I think our organization's saying whatever works in a state or a region. When I visited California, I mean, really big state, lots of different things going on. Regions worked better. I know in Illinois, regions are working better. So I think that's really, we have to just do whatever we can to support it. But I think we just don't want people to have to repeat anything as much as possible. I know our model that we've worked out, our students now finish in 1 year. It's down to 1 year when they leave us, and it's 1 year to finish up, which is wonderful. Yeah. One of the things we've worked out too is tuition. Okay, sorry. Go ahead.
Good morning. My name is Mary Walcott. I'm a nursing faculty with Wenatchee Valley College in Wenatchee, Washington. Recently, we are seeing a trend with our community partners toward the hiring of lower educated healthcare assistants. We certainly support as educators, we support increased education and professionalism. Can you address for us just how we can, as nursing professions, can challenge those trends? They're very much, I think, financially driven. Mm-hmm. And with Obamacare, I think that trend will continue.
Mm.
Thank you.
Yeah, I think, why don't you address that? Because you're...
Hi, you'll see me in a few minutes. And I'm glad all these questions are coming out. So we do know that. We have a program at Robert Wood Johnson Foundation called LEAP, Learning and Education in Primary Care. I don't know what that A stands for, but it is a primary care program. And what we've done is we have looked at models of care all over the country to see what the team configuration is for delivering care in the community. And we have seen some trending towards medical assistants taking over some of the RN and even the LPN role. And, as we say in the campaign, we do promote everybody practicing to the top of their education and training. So we want there to be an effective team configuration. But we also know and worry, I will say, that not everybody understands what nurses can do, what they're able to bring to the table. You are completely right, is being cost-driven. And so we're going to be highlighting that at Robert Wood Johnson Foundation. And we have a new project that we are going to be funding that will look exactly at the RN role in delivering care and, as you called it, Obamacare, the new transformed healthcare system, to help people understand what RNs do bring to the table. And so while you're waiting for that report, I would say that everyone should be doing their part around the country. You know, we encourage nurses and other health professions, but this is a nursing audience, to get on to those health exchanges. This is now the time to show the leadership that nurses have and be involved, because I will tell you, those decisions are being made without you and without us. And we have no recourse if we are not at the table. You must sign up for workforce commissions, anything that you can do. And it's a matter of just finding out who is involved in your state in making those decisions, seeing if you know anybody, if you don't, but just making a phone call and saying, you know, here's my expertise. Here's where I can really, I'd love to be on your committee, or I'd love to be on one of your working subcommittees. But offer yourself as a volunteer. They will make these decisions without you, and they have, and they will continue to do. This is what is happening with the RN role.
Anything else? Anywhere? Out there?
I have something.
Yes.
So I think, this is Mindy Schaffner, Nursing Commission. You know that the state has been working together, community colleges, universities, higher ed, commission, on common credits, basically common courses, that type of thing. And, you know, it's been a struggle for some because there's been prereqs to prereqs. Has this been something too nationally that different areas are addressing and, you know, trying to work on to get, and would there be other strategies? Because I think that it's sometimes the community college presidents and university presidents, the administration, that don't quite agree with it.
I can tell you that, yes, there are those issues out nationally. And I think that, I think that's why the conversations with the community college presidents and university presidents are really very important. And I know one of the things that we actually worked on in Illinois a little bit, at least in my region, was the community college president having a conversation with the deans from the nursing and myself, and also then the chancellor from the university. And it's very interesting because of that conversation now, that chancellor, we were having really a lot of difficulty with, we'd like to do an ADN to master's, but it was being held up by the graduate faculty at that university, not even the chancellor. Once the chancellor got involved, the chancellor was like, we need this ADN to master's. So I think sometimes, you know, getting people in the room, those people like the president and the chancellor, I know it can be a challenge, and it may be depending what the issue is. Having that conversation, I think is very, very important. And I think Sue's going to add something to that.
So the question had to do with barriers, prerequisites and repeating prerequisites, and what's being done about that. So you'll hear me talk a little bit about our academic progression in nursing meeting, and we're doing a lot because the Institute of Medicine report on the future of nursing. Education is a big part of that, and I'll be talking about all aspects of the report. But because Robert Wood Johnson Foundation now has additional many millions of dollars set aside for academic progression, and we have set up an entirely new program office that's separate from but very, very connected to the campaign. That program office will be having what I keep calling, I think they want me to change the name of it, but I keep calling it the barriers meeting. Because, you know, as I travel the country, there are barriers. And so our program office has been busy doing focus groups around accreditation barriers, practice barriers, and academic barriers. And so what you're talking about, Mindy, is the academic barriers, the repetition of prerequisites. And so, just last week, we have set a date in April of 2014. Of course, I wanted it way before that. I want everything way before when we do it because I'm very impatient. And I want all of this work done, while I'm alive, right? But we do have a meeting set up now for April of 2014, where we will bring together important stakeholders to address, I don't know solve, but to address and come up with some recommendations about the key barriers. I think there are a lot of barriers, but those barriers that have been recognized as key, I'd like to think that we would have some recommendations around that and move forward from there. But in the meantime, as I said in my last little visit up to the microphone, if you cannot wait for that big national meeting, please do what you can. And there are important stakeholders in every state that can address this. Some of those things need to be addressed at the national level, obviously. But if there are things that can be addressed at the state level, get your important stakeholders together, and it will help. It will help inform this national meeting.
Mary Baroni from the University of Washington, Bothell. Just a follow-up question to that, to actually both of you. And that is, you mentioned in Washington State, we've been working very closely between the community colleges and the universities for a long time. And we are working on a statewide pathway that approximates a 4-year degree in terms of credits and standardizing prerequisites and nursing major. And over the years of our close working together, we've kind of talked about the pie in the sky of if you had a pathway, could we not have joint accreditation for the pathway and not the setting per se? And I'm wondering if that issue has come up in any of your conversations nationally, because I think there would be a lot of interest in that. I think when we first started talking about it, it was like, that'll never happen, but wouldn't it be amazing?
So I'll repeat the question, and Donna might have the answer. The question is, your comment is you're working well together, the community colleges and the universities, and it truly is a blessing in this state. Both Donna and I visit states where people are still at odds and are not working together. So this is a role model of a state, if you will. So the question was around joint accreditation. If there's a pathway in this country for people achieving, working towards a BSN and higher, what would that look like? Of course, that's what we're working on with our APEN program. And could there be joint accreditation? So here's what I would say. Work it out in Washington before the April meeting. Let it be a model program, and I will just encourage everybody to adopt it. That's very simple. How's that?
We'll do it.
Thank you. Thank you.
I'll do it.
You do it and I'll do it.
I'm Kali Yang. I'm clinical nurse specialist from Valley Medical Center. And I have a question regarding to that, going back to the ADN to master program. Have you thought or discussed about the issue regarding nursing retention on that side? Because I can imagine that with nurses going up to get advanced degree in nursing, their chances of working on the bedside is probably very slim. And going to a different, aspect of nursing administrations.
I guess I can only address it from what I've heard and know. And a lot of the people actually will go on and stay working in the clinical practice setting as a practitioner. I'm not that, I think.
So
Sue
we
has-
should just stay up here together. What do you think?
With our.
Yeah, is anybody on the other end of the
Dizzy.
satellite dizzy with all of our stripes
We
and
didn't plan this.
geometric?
That's okay. That's all right.
So, there are opportunities for master's level people. It depends on how big the healthcare system is, but there's a big movement afoot, and I'm sure that you've heard of it, the clinical leaders that AACN is supporting, and the VA system in particular has completely adopted And those are people who are at a master's level, who are serving as leaders and experts in clinical care. And it would be the same in the community as well. There are clinical nurse specialists. I know not as many as when I was around. I am a clinical nurse specialist in public health, so there were many more of us many years ago. But there are opportunities, and I will say, again, depending on the size, if you feel very, very strongly, if you're a master's level expert in something and feel very, very strongly about staying involved at the front lines, then that's something to bring up with the health system that you're working at or looking to work at, because we do need expertise at the bedside, absolutely.
You know, in the most recent publication, Charting Nursing's Future, that was just released, one of the individuals interviewed her pictures in it, Deborah Turpin was her name, is from a hospital that we work with, and she's the CEO, but it's very interesting. She has, I would say, at least, this is not a huge hospital, maybe 220 beds. I mean, she has at least about 20 master's prepared nurses who basically are working at the bedside. You know, that's what they're doing, or they're working in the ER. And I love that, because then we have faculty, adjunct faculty. But I mean, it's amazing. But she has encouraged that. She's encouraged, because they get a lot of our students, people to go on to school, but yet they wanted to stay in that clinical practice setting, maybe didn't want to become a nurse practitioner per se, but wanted, and it's so interesting that it works, and they are so happy. I mean, they love what they're doing, and so I think, I think part of it does depend on the practice setting and the leadership at that practice setting.
Mm-hmm.
I really do.
Yeah, do you have dedicated education units here in Washington at all? So
Yeah.
that's a tremendous model. Do you have it at your facility, maybe? It's a tremendous model. Now, you don't have to be a master's level clinician to be, and I think some settings are different, but some of the universities that have partnerships with hospitals and use employees, nurses, as their joint appointment faculty do like it when those folks have a master's degree. And I know depending, you don't have to, you can have a BSN, but I know you do have to have a BSN or at least to be a dedicated education unit joint faculty member. That's a very exciting model, very exciting.
Robin Fleming, Washington State Nurses Association, so this is going to show my ignorance a little bit, but in going from ADN to a master's program, for example, I'm imagining that time frame is shorter than the traditional route from ADN to BSN to MN, right? So what factors are in place to ensure that the academic integrity is maintained in a program that's much shorter than the traditional?
Well, I mean, those programs, what?
Repeat the question.
Oh, I'm sorry. The
Academic
question was
integrity.
about an ADN to master's and making sure that academic integrity is maintained in those programs, because they probably would be shorter. First of all, those programs, as far as integrity, they're going to be accredited. I mean, definitely. And I mean, part of that integrity is handled with that accrediting body. But I think they somewhat might be shorter, but I wouldn't say maybe possibly a year, but not, I mean, and there's not a lot cut out, and they're also very different. For example, in Mississippi, they have an ADN to master's, and they're looking at it because one of the problems they have found is that they don't have a baccalaureate option to opt out in that particular. So that's an issue they've discovered. So I think, one of the things I would have to say is with the ADN to master's, you'd always want to make sure you had the opportunity for a student to finish and get a bachelor's degree, because life happens, as you all know. And I think that's one of that particular model with Hines Community College and the University of Mississippi did not have that option, and they're now looking at that because they have found that can be somewhat of a, But I think as far as the integrity of it, I think all of them are accredited, those programs. You're not going to have an ADN to master's program that wouldn't be accredited by CCNE or NLN, and I think, I think that really helps. That's why I'm a firm believer in accreditation of programs, external accreditation. I mean, there's so many things that have to be looked at, and I know people will say, especially community college presidents will say to me, well, our NCLEX pass rate's fine, why do we need to be accredited? Well, there's so much more to it than an NCLEX pass rate. And so I just think that, you know, that's really important because it does help with the integrity of a program. So I think I'm not concerned about that as far as,
Like,
yeah, Mindy.
This is Mindy, so I'd like to just add to that if I might. So I think throughout the United States, a lot of boards of nursing also, you know, are doing approval of advanced education, and more are doing that. And they're requiring accreditation for advanced practice programs. So we do here in the state of Washington require that for advanced practice or master's programs.
Right, that's true. And some states are going to that for even your undergrad or your community college programs where they're mandating accreditation, and I know that's very controversial, but still, it's there.
Thank you for doing that in Washington.
Well, we are gonna talk about it when the rules come up again.
Okay.
Because we're looking at the National Council of State Boards of Nursing model, which does include that. So we'll be having discussions around the state if we can do that or not.
Did you have a question in the back?
I just wanted to add.
Could you address who you are, where you're
Yeah,
from?
I'm Suzanne Stickmo from the University of Washington, Bothell. I just wanted to make a comment adding on to the question about academic progression in nursing and nurses staying in the bedside, at the bedside. And I think our experience in working with both an RN BSN program as well as an MN program, that students can finish sequentially in 11 quarters, is that even if these place-bound students go through, get an R&B, get an MN, they still often go back to their institutions and enrich the practice environment, even if they don't stay in a bedside role. We have countless graduates who go
Very
back
good.
into staff development roles, into middle management roles, into nurse executive roles in those same institutions and contribute to enhancing the practice environment that way.
Right.
So I want to make sure our
Good.
Good,
discussion of
yes.
optimal function isn't limited to just direct clinical care.
So the
You can
comment
repeat
was, when people go on and get their baccalaureate and their master's, even if they don't stay at the bedside, they completely enrich their employing environment, employer's environment, with their education that they gained, and they bring that back. Some students are place-bound and they can't go hunting all over for new places to work, but they do enrich their working environment, no matter where they're working, staff development or in management, et cetera, and that's an excellent point.
It is, really excellent point.
Let's have one last call for any other questions from our satellite places.
Any more questions out there?
There we are.
We're a mess.
Well, I think we want to,
Oops.
is there a question?
Hello, this is Catherine Thompson. I'm an RN case manager, and I work for one of the large HMO organizations in the Portland, Vancouver area. And I am an ADN graduate of 36 years. And I have a question about your ADN to MSN program. I think you had indicated that there were something like
172.
I think it was 172 places where this is in place. And where are the most programs located, and how many are in Washington State or Oregon?
Well, I know the information is on the AACN website, the American Association of Colleges of Nursing. Many of the programs are online type of programs where you may have to, I know frequently we have students that we're precepting because they're in an online program but live close to us. And so they work with one of our nurse educators or even a nurse practitioner depending on what they're doing. But I think going to the American Association of Colleges of Nursing website will list them all, and for sure.
There's one in Washington.
Okay, and that I wasn't, yeah, I couldn't
In
remember.
Washington State, there's one program at Pacific Lutheran University. That's the only one currently.
And Seattle Pacific.
And there is
Seattle
another
Pacific.
university, Seattle Pacific, that is planning to launch one.
Yes.
So
Excellent, yeah,
that's,
excellent.
so that may help you. And I don't know about Oregon, since you're close to the border there.
I think that's the best advice.
Thank you.
We also shouldn't forget the de facto RN programs at Tacoma and Bothell at University of Washington, where a student can get a BSN in 4 quarters and then go into the master's program and complete in 7 quarters.
So lots of wonderful opportunities.
Well, I think we all want to thank Donna and thank Sue early, and we're going to take a 15-minute break. And we will be back at 10:30.
And I just want to thank everybody out there. It's been wonderful, wonderful group. Thank you so much for having me.
Well, I'm going to turn the podium over now to Dr. Susan Hassmiller, and she'll be able to answer all the other questions that we haven't. That we haven't.
Or we'll bring Donna back.
Yes. So let me
wait,
give you the podium.
Okay, what time do I have to?
We've got until almost 12.
Okay, well, very good. So, hello everyone. I'm glad to be back at the podium, and I don't know about you, but I am just thrilled to be alive at the same time that Donna Meyer is alive. She has been a tremendous partner for us with the campaign at the national level with Robert Wood Johnson Foundation, and to have her alive with me at this point is very meaningful for me, and I think we're going to make great progress because of it. So Donna really focused on her organization, NOADN, and what that all the great benefits that NOADN has to offer for you, and the partnerships that she has been collecting along the way over the last couple of years, and I know she has been very busy. So I am going to now switch gears a little bit, even though we will get into education a bit. I am going to switch gears to talk about the national campaign, the Future of Nursing National Campaign for Action. So if we can have the first slide, I will sort of, okay.
No, just wait.
Okay, just wait.
Okay, are you too far?
There
There you go.
we go. Okay. So you know, I should say Donna made mention of the fact that she is now working at a community college, and is in fact the director of a large program there, and received her BSN. I'm just the opposite. I started out with my own community college degree in Fort Lauderdale, Florida, and that was what worked for me at the time. But very interestingly, I knew almost immediately, even though I was on a very similar path to many nurses in this country, Candy Striper and Nurse's Aid, you know that path, you've taken it yourself. When I had my community college degree, I found that it worked for me like 200 years ago when I did this. It worked for me, but I was working on a critical care unit, and I really felt very strongly, and people, it was like a revolving door for me. People would come in and they'd want their surgery and they'd want their medication, and they weren't necessarily paying a great deal of attention to diet and stress and all of those things. And I that's something that I wanted to get into, public health. And I couldn't break into public health at that time without my baccalaureate degree. So I went back immediately and went on that path to public health and community health education. And I actually ended up teaching public health nursing, community health nursing in 2 different universities, and on up from there. So that was my path. The Robert Wood Johnson Foundation, where I work as the senior advisor for nursing, thinks about this, if you're looking at this slide, thinks about these things on a daily basis. Our aging population, chronicity, people who don't have access to care, the high cost of health care. And we exist as a private foundation. Our endowment is nearly $10 billion, and we are by law required to spend about 5% of that a year. It sounds like a lot of money, but we do a lot in health and healthcare. So what we're able to secure for nursing and the health professions is a small part of that 5% payout a year. But we think about these things, and of course, being the director of this campaign for action, I think about workforce and the nursing workforce and what the contributions of nurses might be to a more effective healthcare system every day in my job. And this is really where, can you see this? Oh, where can I hold it up here? Okay. So here it is. This is the Future of Nursing, Leading Change, Advancing Health. If you've never seen the report, this is what it looks like in person. And I'm going to put it back down there. And when we started, I was actually the director of the study committee for this report, which was quite unusual. They usually have staff at the IOM to do no matter what study they work on. There's a close-up shot at that with my teacup. I was trying to hide the teacup, but your angle, there it is. Oh, I can't hide it, look at it. Okay, never mind. I will drink tea at some point during this presentation. But when we went into the committee at the Institute of Medicine, the organization that produced this landmark report, that's also where we started. That is where Donna Shalala, the chair of the committee, started on the first day. Even though she knew the charge was going to be about nursing and the effective utilization of nursing, we had very big thinkers on that IOM committee. A few nurses, but we had other people as well from large health systems. Donna Shalala, the longest serving Secretary of Health and Human Services, of course, under the Clinton administration. This is what she knew. What we need, what does this system need to deliver care more effectively? And then we backed into then what nurses' role was in all of this. I thought I would put this up here. When I travel to different states, I like to show them what I found on them. We do many reports at Robert Wood Johnson Foundation. That's what we do. We do give away money. I should have said that. Of course, you know that. But we really, first and foremost, think of ourselves as a think tank, thinking about all of those issues that I just showed you on the slide. And then we do research, policy reports, we do demonstration projects, we do everything and anything, advocacy, communication, everything and anything to support what we deem to be important at any given time. And at this given time at the foundation, we're working on things such as childhood obesity and making sure our citizens or the people in America are covered with health insurance. Those are just some of the things we find important. And then building capacity in the health professions workforce, particularly nursing, is quite important as well. One of the reports that we do is the county health rankings. So we collect a lot of data on each state and their counties every year, and there's a report, and you can go to county health rankings. I just did a very quick scan of your state. You can get a more in-depth report on your state, and you can see that higher rates of adults who report being in fair or poor health as opposed to the average, fewer primary care physicians per populations here, and so forth. But you actually have quite a number of strengths. There's just 2 strengths listed here, but you have a lot of things going for you in the state of Washington, and I know you know that. One of which you've already said, you work well together here with your nursing community, which is not something that our county health rankings in particular would capture. This doesn't show the whole slide. I wonder if people are seeing the whole slide. We're not seeing the whole slide here. At the very top of the slide, it has patient-centered at the top. I'm not sure why. Is there a way to get to the whole slide?
I don't know.
Okay. You see
Yeah,
it.
one of the rooms in Vancouver is seeing a black screen, but I don't know if that's at our end or your end.
We're seeing a partial screen.
The technician said it's at their end.
It's at their end, okay. So we're seeing a partial screen, somebody's not seeing anything, and other people are seeing, you see patient-centered at the top. So this is an idealized system. I will just tell you that this is where we're headed, not only in the country, but at the foundation. We are working on improved care, lower costs, many different things, as I have mentioned, to get to a more idealized state. If you're a follower of Robert Wood Johnson Foundation, I might give you some pre-news that is not shown on my slides. We have been in some pretty intense strategic planning over the last year and have decided, as many people have already decided in this country, and particularly other countries, that we might get the biggest bang for our foundation bucks if we paid more attention to things such as prevention and wellness. So you will see, not immediately, but within the next year or so, some things will come out in January, but some things a lot beyond January. You'll see more of our reports and demonstration projects and our funding around what we're calling the culture of health. Okay? And nurses can help, no matter whether we're working and addressing issues in our healthcare system or within a larger culture of health. Everyone knows that nurses are there to manage influx of older, sicker, and newly insured patients, and on down the line. When the Institute of Medicine Committee was meeting, and they were learning, because not everyone was a nurse by choice, we didn't want all nurses on the committee. We needed the highest level thinking people who were connected in many different ways, so that when this report came out, we would have those important partnerships and connections, and people in other communities other than nursing would understand it. It has to do with the question that came up earlier with Obamacare and people hiring the lowest possible person, medical assistants and others. Our committee members learned firsthand the value and the role and the responsibilities of nurses, and they really understood, which led them to the evidence-based recommendations, what nurses do have to offer and how they can really lead a more effective health and healthcare system in our country. Yeah, so let me give a preamble. This is the first time I'm showing this video, and this is what I think you're going to see. Well, let's give it a shot. What you're going to see is our campaign. That's okay. Do I need to click on something? Is the summit we had just a few months ago with many of our states and our Action Coalition members who were involved in this campaign. And it'll show them at the summit, nurses and non-nurses working together. So let's see together what this video will show us. We don't have sound, now we need sound. Can you hear that? Okay, maybe we should just not do this. I figured if any state could do it, it could be Washington State with all the technology. Yeah, maybe we just shouldn't do it. Okay. So I messed up the microphone, so you may want to look at this again. All right. Okay, so I hope that is working. Okay, we have some kind of help here. There we go.
And our IT person went out to call the other side that was having trouble, so little did he know we would have some trouble.
Okay.
Maybe we could show it.
That's okay.
Because we can use the sound for
So
something.
at least the folks who are involved in the Washington State Action Coalition know that if that this clip is available, if they want to do speaking engagements of their own around the state, they can use this. And you have the link, so do use.
Do you want us to try again with the video?
I don't think so. I think that's okay.
So where's the link?
You have the link?
I have the link.
Okay, so we'll give you that link. I think it would be helpful as you're talking to the different groups around the state. All right, so the IOM report, 43 recommendations, and they each sort of found their home in one of the 5 categories: leadership, patient and care, education, interprofessional collaboration, and diversity. And I should tell you, if you don't know about the Institute of Medicine and the recommendations that they produce in the reports, there's not one recommendation that can ever come out unless there is complete evidence and research to back it up. There were some recommendations that the committee wanted to make, for example, but insufficient evidence was found, and there's a lot of checkpoints along the way with review committees and at the end with attorneys. So getting out a report of the Institute of Medicine is very difficult, very tedious, but you can be assured that every one of those recommendations have evidence behind them. So I'm going to try to go very quickly. As I said, Donna focused on the education part of the report and only just one part of the education part of the report. So let me quickly highlight some of the other parts of the report, and we can talk about, why is this going backwards? Okay. All right. Go back one, let's see what it is. No, let me go back one more, let me make sure we're at the, yes, go back to leadership. One more. Okay, so leadership was the first category. It's really interesting because everybody knows that it's very important to have leadership skills and leadership capabilities in order to get some of the work done that we want to get done with the IOM report. And there was talk amongst committee members, do we sort of weave it in, or is it its own chapter? Should there be standalone recommendations? And Donna Shalala was on the Hill one day and came back to our committee and said, I finally get it. She said there was testimony being delivered on Capitol Hill, and you have to understand this was about 4 years ago when debates on health care reform were just very avid and boisterous. And she came back and said there was a committee, a panel providing testimony on delivery of care, and there were 2 physicians, a policymaker, someone from a pharmaceutical company, and an attorney. But she said it struck her that as we were talking about how to redesign care in this country, sort of like what we were talking about before and being at the table, she said there was no nurse on that panel. And that's when she came to the conclusion that recommendations around leadership in this report would stand out, are so important. Nurses need to be at the table. There are a number of recommendations on leadership, but one of the ones that we are particularly tracking, and you'll hear more about it this year, is getting more nurses on hospital boardrooms. And that sounds very narrow, but it's something that we can track because we do know in this country, according to the American Hospital Association, that only 6% of all board slots in the country are taken up by nurses. And you can imagine the decisions that take place behind boardroom doors on quality, on safety, on healthcare delivery, on the role of the RN. And if we don't have nurses on those hospital boards, it is to, I think, the detriment of care in this country. So that's one thing that we are really promoting. And there is a lot of evidence that speaks to building the capabilities of nurses in this country, not only at the front lines. This slide particularly has to do with a study that we did over a number of years when we had our Transforming Care at the Bedside program active. That program has actually gone viral. It's all over the country now and in many places of the world. But we did find that there's quite a bit of evidence when you build leadership capacity of nurses, not only at the front lines, but managerial levels and beyond, it really does affect patient care. Excuse me, we have a number of programs that action coalitions, and I mentioned that earlier, and I should say that when the report came out, my president is very fond of saying that we did not want this sitting on the shelf, and I personally didn't want to be part of any report after all of that hard work, getting all of the recommendations through, of having this sit on a shelf. So it was very important to us that we find a way, and it started as an implementation project, if you can believe it. And because of the enthusiasm of many nurses around the country and others who wanted to do something with this report, it was because of the demand from this country, the nurses and others, that we really settled on a national campaign. And then we had to figure out how we were going to get people involved. And it turned out, if this was going to be a campaign, we should run it like a real campaign with state level leadership, national level leadership, and that's just what we have. And because we like to say that this campaign is not about what's best for nurses or what's going to make nurses happy, but this campaign is a campaign that has to do with what's best for the people in this country, people, their families, and communities. Getting them, and I'm going to use our new language, getting them to a culture of health, but actually helping with access to care, cost, and quality as well. So if this campaign was a campaign for people and consumers and how to get them to a better state of health in the country, what better partner do we have than AARP? Because that is what they stand for. So we, and this is part of what this video showed, I'm kind of spieling this off, but that's why we're so proud to have come to this partnership, this national partnership, and many times we are in partnership at the state level with AARP as well. I don't know the involvement of your state AARP in Washington, D.C., but we believe it's a wonderful brand, RWJF and AARP, and what it stands for. And so then, how to implement this? We developed action coalitions, and we started with 5 action coalitions to sort of be our guinea pigs to implement some of the recommendations. And that's what you're doing here in Washington, D.C. You have an action coalition. Linda Tiemann is one of your leaders in the state, bringing together many partners to promote and implement the recommendations. So in leadership, as we look at the state action coalitions and what they're doing, here are just some examples. North Carolina and Wyoming have developed nursing leadership institutes. Virginia and many other states. This next one is very popular. And in fact, what's called 40 under 40, and it's sort of obvious what the title means, making sure that we have new leadership, people under the age of 40, and recognizing them and making them a part of the implementation of the IOM report. And it's interesting, In New Jersey, we get a document every morning if you're signed up, New Jersey Biz. And I was looking on that the other day, and the community of New Jersey for healthcare leaders and 501c3s has this same program. So it's a popular program. It's one that many of our action coalitions are replicating. 9 states are reporting that they are filling state leadership positions. So some of the states are doing a gap analysis and identifying what some of the most important leadership positions are in that state. I mentioned earlier getting nurses on the health exchanges, right? That would be one. But states are doing a gap analysis. What are those important decision-making positions? And then
just finished one here.
you just finished one here? Oh, wonderful. And then trying to figure out who you have and doing a match.com, so to speak. So excellent. I'm glad you're doing that, Linda. Linda Tiemann said that she's just done a gap analysis here. We are working with other organizations, the Leapfrog Group and Magnet, both organizations that are recognizing nursing leadership within the ranks of their organizations that they accredit, and if they have sufficient nursing leadership, that they sort of check the boxes with Magnet and a Leapfrog. And there are many action coalitions who are working on the leadership recommendations. So there is a call that people can be part of. It's the Leadership Learning Collaborative, where people are sharing freely. How did you start that 40 under 40, or how are you getting nurses into hospital boardrooms in your state? One recent opportunity that I thought was very important, but I didn't really want to distract people from working on the recommendations, whether they be in education or practice or leadership. But then I thought, this is about nursing leadership. And it's around enrolling patients in the new healthcare system, in the marketplace, in the exchanges. So what we did was we set up a web page on our website, and you can see it says Leadership and ACA Implementation. And as my foundation believes strongly, however you might feel about the law, it is the law of the land at this moment, and our foundation, because we have taken on covering the uninsured and that issue so strongly with lots of money and lots of research and power behind what we're working on, we believe that nurses should be involved in this as well. So I agreed to promote that with the campaign. We have a web page, and if you go to that, it will identify how nurses can message, can talk with patients, and help them get signed up for health insurance. So removing barriers to practice and care, the one thing that you will hear coming out of this campaign is that all practitioners, all nurses should practice to the top of their education and training. You've heard that, and we actually say that about all practitioners, but we know there's a lot of barriers that nurse practitioners have before them, in particular nurse practitioners and certified nurse midwives. You can see in this map where we follow our progress of the country that Washington is doing pretty well and has been doing pretty well. You're a green state, which means that you don't have the barriers that other states have. I go into some of the other red states, Florida and Alabama and Texas, and actually nurse practitioners go to school there, and because they can't practice what they learned in school with very simple things, many of them are leaving the state. And I say that quite boldly, and I say that to the policymakers in those states, hoping to gin up some action so that they might alleviate some of the barriers for nurse practitioners. It doesn't make sense to a funder because we fund, as I'll talk about as I go along, we fund a lot of scholarships. So do your employing organizations, hospitals, and other foundations. State governments are providing, and the federal government is providing scholarships. If we give somebody money to go to school with the idea that they will help with access issues in this country, and they come out to a state and they can't do what we gave them the money to go to school and do, it's not a good investment for funders. So from an investment standpoint and from an economic standpoint, you know, allowing people who don't charge as much to do primary care, it just makes sense all around. But as you know, there are many barriers and many millions and gazillions of dollars being spent to keep those barriers in place. And it's quite something. And there's, again, my foundation, the IOM, and the Institute of Medicine only promote recommendations that are completely based on evidence. And so there is much evidence in this country that says that APRNs and certified nurse midwives can deliver care at a cost-effective rate with high quality and safe care as well. And these issues are being played out in many reports in the media these days, and a lot of it has to do with healthcare transformation and who we're going to use to deliver care in this country, and the shortage of primary care providers, and what states are supposed to do with the increase in enrollees. And so there's a lot of literature, a lot of media being played out around the nurse practitioner issue. If you need anything in your state in terms of evidence or articles, we're collecting everything. So we do have it. You can see here that 7 states have actually been successful in removing barriers to APN practice and care lately in the last couple of years. Many more states are making attempts in their own legislation. And interestingly, and I always say this is Donna Shalala. She was the chair of the committee, as I mentioned. This was her favorite out of the 43 recommendations. This recommendation around states contacting the Federal Trade Commission was her favorite recommendation. She knew that this would be an enormous barrier. We have had 9 states now in the national campaign, and it has to come from, the petition has to be made either from a governor or a state legislator. So not in 9 states, one of those 2 bodies have petitioned the FTC around making a ruling, coming into the state, making observations and doing interviews, and then making a ruling as to whether there is restraint of trade in that state. And all of this is public. You can go to the FTC website and see the actual letters. In every single case, restraint of trade has been identified, with the recommendation to those states that have made that petition that they look at their barriers and loosen those barriers. So here's education. There are 3 groupings, even though there were a number of recommendations. Let me take this a minute here. A number of recommendations around education. They tended to group in these areas, increasing the proportion of nursing with a BSN and higher degree, increasing the number of nurses with doctorates, and then implementing nurse residency programs. And so why BSN degrees? I mentioned before that the majority of people on the committee were not nurses, so they really had to understand all of these issues. But remember, they started at a much bigger place. What was going on with patient care, safety, quality, access. Those were the big issues that they were grappling with as they made their decisions then about nursing. They learned firsthand, for example, as they began to make their recommendations about the BSN or higher, they learned that the vast majority, like myself, of nurses came from a community college degree. They learned that, and they knew this firsthand, but they learned and knew that our systems of care in this country were extraordinarily complex. Everything that Donna Meyer said when she was at this microphone, when she was a nurse, there was a much longer time to spend and get to know patients. It's not like that anymore. So care is, they call them critical care. Every floor in a hospital is almost like a critical care unit now. The committee members learn that there is a crushing, and I use the word crushing purposefully because it's almost one of our most significant issues in nursing now, a crushing faculty shortage. For the first time in the history of the federal government giving loans to nurses to go back to school so that they can then teach and be faculty members, and then if they actually teach, they don't have to pay those loans back. For the first time in the history of that program, nurses are paying back those loans just so that they don't have to teach. And that is crushing. We have severe faculty shortages at both the associate degree levels and the baccalaureate levels. So they learned about the complexity of care. They learned about the faculty shortages. And then, of course, much of the discussion had to do with who's going to provide care in this country in regard to primary care. They knew firsthand that there was a shortage of primary care providers. So adding all of that together, the committee made the recommendations. They saw vast majority of community colleges, they need more people progressing. And that's why they made those recommendations that more people should have a baccalaureate and beyond. Did they ever say anything about closing community college doors? Absolutely not, never. In fact, there were many people on our committee that knew full well, like me when I was starting out, there needs to be options for many people in rural areas, sometimes in urban areas, but there need to be options. And we all know that associate degree schools help tremendously with the diversity of our workforce. And it's not that the baccalaureate programs are not helping with diversity, they are, but we need everybody working on that issue in particular. So for all of those reasons, that's why the committee came up with that. And of course, evidence. There were reams of evidence on all of those counts, and evidence too that showed that there was some connection between education in hospital settings and mortality rates. Because of all of that, I mentioned earlier that our foundation is putting together many more millions of dollars to address this issue called academic progression in nursing. And we awarded 9 states. Washington was a winner, was a recipient of one of those grants. They had to be working on, in order to get an APN grant, states had to already be working on a program that allowed seamless progression for nurses between a community college program and a baccalaureate program. We are putting our stock in these 9 states to show how it's going to work. I told you they're taking on those barriers, those academic and practice and accreditation barriers. So within this particular program, we hope to have role models that other states would then replicate as to how this should happen in the country. It's a 2+2 program, so you see the states here. If these states within 2 years meet or exceed the benchmarks that they set forth for themselves in with the programs and seamless progression and getting students in and helping to get them graduated, then they would be eligible for another 2 years of funding. I want to mention the last one because it has to do with doubling the number of doctorates in this country, the pressing faculty shortage. There was a recommendation that we should double the number of doctorates in this country. When the report was being written, and it's pretty close to that now, only 1% of all nurses in the country have any kind of doctorate degree. And if there's around 3 million nurses, that's around 30,000 people. And you know that if we have all these faculty positions to fill, A, and B, we need nurses to help with the solutions of our health and our healthcare system. We need nurses to be part of doing research, being part of technology advancement. All of those things that nurses at a much higher level can achieve in this country. So just this year, we launched something called the Future of Nursing Scholars Program. And that is bringing funders together in this country to support scholarships for PhD education. And why do I say just PhD education? Because our foundation generally works on things that the market can't or won't do on their own. If you look at the data, the AACN data, you will see that everyone has jumped into the DNP wagon. And so it's trending that those students, you know, it looks almost like Mount Everest, the number of students going into the DNP. So our foundation, therefore, is taking on providing scholarships for PhD, not only because of the faculty, but because of, as I said before, advancing nursing science and research. Diversity is very, very important to our foundation in particular. There's hardly a grant that you can get at our foundation anymore without, no matter what the subject matter is, without also addressing how you're going to work diversity into your plan or your program. We know that about a third of our country right now are from minority populations. In California, they are already the majority. So California is the first state to achieve a minority majority status. And other states will be closely following along that line. So we know with nursing, the nursing workforce at being only 18% diverse at this moment, we need to do a much better job of ensuring that our nursing workforce looks like the patients that they care for. So if you are working on an APIN grant, and Linda knows this, if you're working on an APIN grant or any of the grants that we are providing throughout this campaign, you will be addressing diversity as well. And we have brought on some diversity consultants, many ways, technical assistance, to try to help states with this issue. Go beyond that. And the last one, interprofessional collaboration. You know, I'm not sure how much I really need to say about this. If you go to school with other professions, if nurses go to school with doctors and pharmacists and social workers, there is, we know, again, the evidence, the research, we know that there is a much greater likelihood if you take classes together that you will understand each other's roles and responsibilities, and you will have respect for others as you work side by side in caring for the patients of this country. So it's something that we are very much promoting at our foundation. In fact, we are in collaboration with 3 other funders, the Gordon and Betty Moore Foundation, the Hartford Foundation, and HRSA. We are funding a center, as you can see from the slide, a center for interprofessional education and collaborative practice. We hope that this will be the go-to place for not only academic institutions, but practice settings to go for how to do interprofessional collaboration and what the evidence might be, how you can talk people into things using that evidence. And let me see what else I can say. Within our states, we know that some of our states are working on interprofessional collaboration. We have something called State Implementation Program. If you were not the lucky recipient of an APIN grant, Washington was, you had the opportunity then to get grant funding from us called SIP funding, State Implementation Program funding. And with that funding, which is not as much as the APIN funding, you had to have some matching funds to get that. And you could work on up to 2 recommendations within the IOM report. And so a number of, I would say that almost everybody in this country, of all of the thematic areas that I'm talking to you about, almost everybody in the country with that SIP funding is working on education progression. Even if they have asked for money in another area, such as leadership or interprofessional collaboration, they are working on education progression. The next most popular area to have asked for money from is around those leadership recommendations, how they're going to get more nurses into leadership positions. And then we have a couple of states that have received money for their work around interprofessional collaboration. So I mentioned that if you received SIP funding, that you had to get matching grants, and that's very, very important because this campaign won't be around forever. You know, we are here, no matter what work we get involved in at the foundation, whether it's coverage or smoking cessation, our role is to stimulate the market, move the market, do as much as we can with policy, research, communications, advocacy, evaluation. We're very big on evaluation, determining what we learned and spreading those lessons learned. But we can't possibly stay in one area forevermore. Foundations don't do that. So it's very, very important that states, all of our 50 states that are involved in this action campaign and the District of Columbia, really build their own capacity at the state level. And so that's why so often we ask for matching funds so that coalitions, no matter whether it's the nursing one or others that my colleagues at the foundation are working on around coverage or childhood obesity, we know that those matching funds are just critical. So you can see that with 30 states that will be receiving this other funding now, they have raised, and this is significant, not just with SIP funding, but with other funding, with other of the issues they're working on as well. $6.1 million has been raised around the country, just the states, not counting RWJF money. So this is significant, and we're happy about this. Our board is really happy about this. So that's why I like to collect these numbers. It has to do with leveraging resources. So finally, here we are, the Future of Nursing Campaign for Action, and here are all of the entities that are working very hard on implementing the recommendations of this report. Sometimes I talk about Florence Nightingale, and my last slide is next. But when I knew that I was going to be working on the Future of Nursing report and with this campaign, I wasn't particularly, when I was a student in my community college and then on, I wasn't particularly interested in history, what those old ladies did in the past. You know, all I wanted to do was get out there and start an IV and start taking care of patients, right? And I didn't really pay a lot of attention to the history, but in becoming involved with the future of nursing, I really learned that I had to pay a great deal of attention to what came before us. And this campaign has been built on the backs of so many people who have come before this campaign, who have come before me, all of the nursing organizations, Linda's nursing organization, so many. And I've studied Florence Nightingale a lot, more than I ever did in school, much to the chagrin of my professors, and learned that in all her work and all the things that she wanted to implement, and when she came back from the Crimean War, she had a report to implement as well, the reformation of military medicine. And there's no way that she could do what she did with just nurses alone. I mean, she didn't have all the great nursing leaders in the organizations that we have in our country today by any stretch of imagination. But she got her report implemented and many of those recommendations, and she did it by calling upon policymakers and lawyers and doctors and important businessmen. And I say businessmen because they were businessmen in her day, right? The important businessmen of her time. And she was also very close to royalty. I don't have that connection myself. But so she used many partners. And if you look at the recommendations in this report, all 43 of them, you will see that although nurses have the greatest amount of passion and enthusiasm and experience, and they have a lot of the evidence, it will not get implemented without all of these entities, the people who work for these entities and the entities, it will not get implemented without working together. Consumer advocates, that's why we're working with AARP. That's why I so often speak to policymakers and say, what in the world are you doing? You're giving these scholarships and you know these people are leaving your state, you know? So we need all kinds of people to make this happen, and quickly. I said I was very impatient in the beginning, and I am. There's a lot to do. There's a lot that has been done. But we have a small window. We have a small window to get our work done. People are interested in nursing now. The transformed healthcare system, the attention being brought to this IOM report that remains the #1 report at the Institute of Medicine. The #1 reason why people go to the IOM website is to look up this report. And they have people from all over the world. So there's a great legacy with the IOM as well. This is the website. I encourage you to go there. We do hope it is the place to go for what's happening with the campaign in all of those different subject areas. Oh, I thought I had one last slide. Sometimes I have a slide about Florence Nightingale, but I gave you the spiel about Florence anyways. So I am honored to be here with you in Washington. I appreciate so much your involvement and everything that you're doing and the role model, and I mean this, the role model that you will be for the rest of the country. You are already a role model with your practice and barriers to care. People are looking at your laws and how they can replicate them. People are looking at what you're doing with education and progression and how you're working so well together. This isn't going on around the rest of the country. So I want you to be a leader. I want you to be a role model. I thank goodness that Washington is part of this campaign, and I thank you for asking asking me to be here today. Thank you. So, questions?
I'm looking at the tech people. Are you going to try to do the video? Or do you want to?
We can put the link up for you if nothing else.
I don't know that it's necessary. Yeah, but why don't we put the link on?
Yeah, we're going to put the link on the Washington Center for Nursing website.
Yeah.
Thank you.
Let's just see what the questions might be.
Yeah.
I'm afraid at this point I would have said what the video said,
Oh.
only with less makeup because they put a lot of makeup on you when you do videos.
Yeah. So why don't we go to the satellites first? Are there any questions from our satellites?
Yes. Terry Nosak, Clark College, Vancouver, Washington, and thank you so much for being such a great leader for nursing. My question is, once again, looking at the progression, the academic progression.
Can we see the people?
From a national perspective, when we're talking about diversity, because we want to ensure that our workforce looks like the population we care for. So in ADN programs in particular, and I'm mentioning this because there's a lot of first-generation students and a lot of ENNL students, and they have special challenges or opportunities, I'll call it, that they face in being able to be successful in progressing quarter to quarter through graduation. So I'm wondering nationally, what do you see as far as strategies to help these type students succeed so that we can meet the goal of our diversity workforce actually representing the population they serve?
Well, I'm going to start, but I really want Donna Meyer to answer this question. So I do know that in our APN, when I say APN, Academic Progression Nursing Programs, part of what is being modeled is this seamless articulation, but as our model sites are discovering, there needs to be some kind of wraparound services, mentoring, social support that goes into what's going to make a successful and seamless articulation. We know that, we are looking at that, and those strategies will be highlighted. Donna, what else would you say?
I'm going to totally agree with what Sue just mentioned as far as almost like, you know, for lack of a better term, a one-stop shop for these students. They really need that. And I know with our own learning specialists, as I've talked to people across the country, from a learning specialist standpoint, they said, they'll tell you that the biggest part is not so much the learning strategies, so much as being a counselor and helping them through some of those things. The other thing I just want to mention about the diversity piece is I think sometimes, I will give you an example, and I'm not even sure if Sue's exactly aware of this. So I actually helped in New Mexico, Navajo Technical College,
You told me.
okay, set up a nursing program, an associate degree program. And what I heard from them, and I think this is really important for the diversity piece, is that they really wanted people from the reservation to become nurses. And I think all of you in this area of the country can relate to this more. But what they were told was, well, okay, come to the University of New Mexico, come to Gallup, or come to Albuquerque. And that is a real issue for these individuals because, first of all, they're concerned if they leave, they'll never come back. So I think when we're thinking about diversity too, we also have to think about getting those programs to where those diverse individuals may be. You can't always expect them to leave, and I'll tell you, in that area of the country, doing anything distance learning wise is a real challenge at times. So we created a small program, and I'm happy to report we have now graduated the first class, and they have 15 more students that just started this fall. But I think that gives you an example of some of the challenges we face with the diversity, is that we have to figure out a way too how to get these programs to the students that do come from those diverse backgrounds, as well as providing them with the resources. And some of it is the time management, the financial support, not only the learning initiatives, but also, you know, helping them with their family needs. You know, they have children, you know, I mean, it is just overwhelming. And so I just think there's lots of issues around that diverse piece. Yes.
Yeah, I have one other thing to add about that. In Washington State, there are a couple of schools that specifically have, if you will, a back-to-school night for these students where their families have to come. And this is
Right.
about, if they are first generation,
Yes.
it's for the whole family to understand, it's not the student who's going to school,
Yes.
it's the whole
Right.
family. Because they often don't understand the roles they can play in making it possible for that student to complete the program. And there's been some great success reported
That's
with
great.
having
Yeah,
that kind of an intervention. So-
Yeah, that's really great, and there's evidence to show that if a student has family support, that they're much more likely to graduate. And when I went to Montana, one of our APN sites, it was really interesting. I'd never experienced this quite before, but they're working with the Native American population. So I attended a session where the kids came as well. And it was interesting, but it just gave the mothers, and there were actually, I think there were 2 men and the rest were women, but it gave the parents, I will say, just a sense of security to know that their kids were there with them.
I'm Robin Fleming with WSNA, and I wanted to add to that as well. So I think really including our secondary school system is really a key factor. And
Yeah.
I know that Seattle Public Schools had a program that was funded by the Associates in Supervision and Curriculum Development and Robert Wood Johnson Foundation, and it was
That's
a
right.
public health education program to try to interest immigrant students in public health careers. And it was, there was a research evaluation done in the program. It was successful at getting them interested in those careers, able to see that they were capable of doing that work. And so I just think we need to get out of our silos and really work.
And I'm glad you brought that up, because I was standing here thinking about a program that we actually instituted with high school sophomores. So it was a program that started in their sophomore year and continued on for 3 years until they came to the community college. And it was interested individuals in healthcare, but specifically nursing. And the first year was just more like some type about, socialization things and those. And then the second year was working on some math, science, and reading. And then the third year, they actually became CNAs in the program. So they began to get out into that career. They also could earn some money. And then they transitioned into the community college, but they had already been there. And it was a wonderful program that had great success. And it was centered on that diverse student.
So the comment was about the importance of secondary schools. I was just in the state of Rhode Island and moved to tears, actually. I visited the only charter school in this country completely devoted to bringing nursing students in, people who felt that they wanted to be a nursing student, in at the sophomore level of high school. So it's a charter school. They come in, it's for inner city kids. The diversity rate is at 85%. 85%. So they came in as a sophomore, they attended high school sophomore, junior, senior, and then they attend their first year of college in this setting. They have partnerships with the University of Rhode Island, and these kids are incredible. And that's what made me think of it, because they learn first how to be nursing assistants. And a lot of these kids will be the first, not only the first time college graduates in their family, first time high school graduates in their family. And these kids were on fire. I've never ever seen anything like it. And I was telling somebody about it a couple of weeks ago, and they told me, well, they're going to replicate this charter school. I can't remember which state it was. But I hope more states replicate this. I know charter states, you have to have a law to allow it, and I don't know if you have a... You do. So you can do this. Another thing for Washington to do and be a leader on.
I have a comment from Spokane.
Which is mute.
Okay, go ahead, Spokane.
Yeah, can you just remember to wait, could you just make sure you mute your microphones unless you are asking a question, because we're getting some feedback from somebody. And then Heather, go ahead, please.
Hi, I'm Heather Stevens Selby. I'm the acting dean at Spokane Community College. I have 3 comments. One, there's an active group here in the state for high schoolers to do CNA programs, and it's throughout the state. The curriculum's well defined.
Oh, that's
and
great.
Actually, they collaborate with the CTC, or the Community Technical College System, and so they take them as juniors and do CNA, and that's pretty pervasive across the state in different areas. I know here in the Spokane area they do it in Shawela, for example, which is a smaller community. My other comment is about diversity. You do have some model programs in Washington State. Renton Technical College has an 85% diversity rate and has a high completion rate, and a lot has to do with IBES, Integrated Basic Skills Education Training, and another pedagogy called Reading Apprenticeship. Very successful. Seattle Central is another one. And those programs have been going very successfully, probably for about a decade. So you do have some great models on diversity, particularly in the King County and Pierce County region. And then my third comment is about engaging our community partners. And so luckily here in Spokane, I have some partners here that are not educators per se. And I think it's really important to get those community partners, industry partners to the table on a regular basis as we develop the progression and really create the dialogue between us, because oftentimes there is that gap between us and education. Thank you.
Thank you.
I have a question back on the CNA program. Is that a dual credit program where they receive college credit at the same time?
Some of it is. It kind of depends on the actual county they're in and who their partnership is with. For example, a lot of the King County schools, they consider it tech prep, technical preparation training. So, and we do a biannual conference with the high school system to engage healthcare programs and ensure things like biology move on into transition into college biology and math. So there's been quite a bit of work in the state on those levels.
Okay, thanks.
Hi, my name is Cameron Brown. I'm actually.
You know, why don't you, if you have a question, come up, because instead of us trying to put words in people's mouths, and people should see the wonderful people in this room. Okay, here we go. Here we go.
First one. Thanks for that. So my name is Cammie Brown. I'm actually with the VA, and we are a part of 5 National Centers of Excellence in Primary Care Education that work to train, do interprofessional education with nurse practitioner nurses. My question is actually around leadership. And it's around one of the things that we're finding. So we have a model that has physician co-directors and nurse practitioner co-directors, myself being the nurse practitioner co-director. And what we're finding is, how do we, VA being a slower to move place.
Oh my God.
I'm being nice. Mindy says I'm managing to get around these things, and I'm not sure if I am. But how do we, if we're not quite at the level yet of having these established leadership models, how do we help grow our own leadership when we find ourselves, we are kind of doing things in our own kind of silos, or how do we leverage, how do we build from within, I guess is what I'm asking. Leadership is an important point, but I guess I'm trying to figure out, how do we build in flight?
Yeah. Well, first of all, we need more people like you, right? Everybody agree with that? I would say that, you know, you have to get buy-in from different people. I think the more that people get to know you and trust you as a person and can see that this is working, that's generally what it takes. People are mistrustful of change anyways. They are less trustful if they get to know you, they see it's working, they can, you know, you're not an intimidating person, and you're your physician colleague, and you can talk about it openly. That's the only thing that I would really offer you. What about other people? What suggestions do you have for her?
So I think, just to add a little more texture to it, one of the things we're finding in our 5 sites is, when you think about things from a system standpoint, and you think about instituting lean, performance improvement, if you think about even some basic things when we start talking about publications or presentations. I actually was in business for 10 years before coming into nursing and did consulting, and so I'm used to kind of having more polished presentations. Some of my counterparts in the other 4 sites, this was very off-putting for them. When you start having discussions about ROI, right?
Yeah.
And that's not built into our into our programs. And so then, how do we now are trying to build our own leadership together as a 5-site cohort, but then just for then, as we think of how can we get to those national boards, how do we build that? I guess is my question. Or how do we iteratively create that?
Yeah. So come up. Let's all come on up here so people can see. You know, there are a lot of you know, there's leadership training. I mean, there's formal leadership training, right? And then there's informal leadership training, and it seems like you're an informal leader. You're a mentor to other people. You need to be prepared. You wanted to say something, Mindy?
I was just going to say, what I know about Cammie, though, is that she is prepared. That was going to be my comment. She has her information. She knows the data. You know, she presents it well. I think that's all really critical to what you're doing, and I think that's why you know, you are moving. You are making headway in a system that's, you know, pretty heavy.
And it sounds like you need to help other people. You need to be a role model for other people and help them along with presentations, how to speak before groups, how to prepare slides so there's not, you know, text that people can't read, interesting pictures. So,
I wanted to add one
yeah,
other thing.
come
You know, the Action Coalition in the state does have a leadership work group.
Okay.
And we're that work group is the group that just completed the gap analysis across the state of where are nurses on boards, what boards are looking for nurses, who are nurses who are looking to be placed on board. So we're going to do a little speed dating there, because it's the first time we've taken a look to see, well, where are the opportunities. So that may be something you want to help us do. And we do, like some other organizations, we do leadership education, and we focus on staff and charge, entry-level nurses, direct care, you know, and we start with leading others, knowing yourself. And next week there are 2 sessions of 70 people who are being part of a workshop on creating the change you want to see. So there are some other opportunities, but it is a big job.
you know, your associations have leadership training as well. The American Nurses Association is coming out with training now, working with a couple of universities, Arizona State and Capella, I think it is that right? Yeah. On frontline leadership, mid-level leadership, and executive level leadership. So you can sign up for these things. Robert Wood Johnson Foundation has leadership programming. And I am coming out with an article soon in American Journal of Nursing. I can't remember. I don't think they assigned a month yet, but it's called "Are You the Best Leader You Can Be?" And in that piece, it's very little text from me, and it's mostly a matrix of what I put together of resources in this country for nurses, with many associations, organizations, with links and phone numbers, and what the leadership program has to offer. So people can go immediately to this matrix and look at, I have it separated by beginning leadership, mid-level leadership, and executive leadership. So you can categorize yourself, you can find your color code, and you can go immediately to sign up for something. Come up here. Come, you've talked a lot, so people need to see you. People need to see you. Come on.
I talk too much. So I was just going to say that thank you for sharing that with us, because that's something, a link that we can put on our WSNA website. We do have online continuing nursing education, and we do have a module right now on bedside leadership, which is not what you're talking about. But what I was going to say about what you're saying is taking some of these leadership courses would probably be really beneficial, and it reminds me on a more basic fundamental level of sort of a school project. So remember when you were in school and your teacher made you work in a group and everybody had different skills? So sort of doing an analysis and determining who has what strengths, because not everyone's going to be great at PowerPoints and great at speaking and all that, but they have other strengths that are really important to developing a leadership model that you can create while you're flying that plane. That's all I was going to say.
And you might want to sign up for the Robert Wood Johnson Foundation Executive Nurse Fellows Program. It's not that simple. It's actually a competition. It's not something you sign up for. You apply for it, and it's a major competition that many people want to get into, and just a small number each year get accepted. So, other questions? Questions from the satellite? Okay. Oh, questions? Mindy, come up here. Okay, go ahead.
We have one on satellite.
Okay, come on. You come up here next time. Go ahead.
Hello, this is Victoria Fletcher. I'm down at the Clover Park Technical College site. I'm a member of the board of the Washington Center for Nursing. And I have a question regarding advanced practice nurses. And in our state, we are fortunate that we have independent practice and some of the most unrestricted laws in the state. However, we are finding that the accrediting boards themselves are limiting the scope of practice of advanced practice nurses. So, for instance, a pediatric nurse practitioner may not be able to provide care to a young adult gerontology nurse practitioner may not be able to provide care to a young adult, for instance, or a women's health nurse practitioner who treats sexually transmitted diseases in women may not be able to do that in a male population. So what are some of the strategies that you're seeing across the country to address these limitations?
I think that when it comes to accrediting bodies, good luck. And you just need to if there are many people who have the same beliefs that you do, and if you show evidence that these folks can provide care across their, across another, not discipline, a subject area, then, I think you have to take it before the accreditation boards.
Mary Baroni, the other thought that I had is that some of those limitations may be related to the scope of practice of particular specialty, advanced practice roles. And so working with the organizations, especially organizations that act to maybe revisit their scope of practice might be another way to begin to think about this.
So this actually fits.
Yeah, I was just going to say one thing, and when we talk about making sure that all nurses practice at the top of their education and training, it really, and I'm glad this conversation has come to the fore, because it's not just about laws. People have barriers in many different ways. There are laws, and then there are regulations, government regulations from CMS. There's a lot of barriers there. And then, of course, there are institutional barriers. People can't get on a panel because of an institution, perhaps. And then finally, it's what I call, there are cultural barriers. There are other people, there are other health professions that who we work with that has their own prejudices and bias towards nurse practitioners and advanced practice nurses. So there are all kinds of different barriers that we're contending with.
Okay, so Martha Wooster, I don't know if you're out there, she's our ARNP advisor for the Nursing Commission. But I will say that, and this kind of is a segue to one of my other questions. The state of Washington has a scope of practice decision tree that's on the Nursing Commission website. And I think if you work yourself through that, I think in all areas of our practice, it's pretty open. It totally relies on the person's education, experience, training, knowledge, and then ultimately at the end of that decision tree is, are you willing to be responsible for this action? You ultimately are responsible. So you have to have that educational preparation to do it. So we have family nurse practitioners that have more education in terms of mental health, and they are actually working in mental health clinics, and vice versa. So people, have broadened their scope of practice by virtue of education.
Thank you. Thank you. It's great to have knowledgeable and experienced people in the room. Okay. Other questions? Going once? Going twice? Okay, that's it. Linda.
Well, I think great. I want to thank all of our guests here and our hosts again, and I want to thank the satellite folks for sponsoring this and gathering people there, and want to tell you all that the handouts and the link to the video will be on the WCN website. That's wascenterfornursing.org. I know you've all got it bookmarked. And in addition, we'll be sending you a Survey Monkey, quick survey to tell us what you thought, how this worked for you, what could be different. We do want to keep you engaged. If you haven't visited our website in a while, it's been updated, and there is a page for the APIN work, the Academic Progression in Nursing work, and a page for the Action Coalition. And if you're interested to join in the work, it's easy for you to do that. It's easy for you to sign up to get our newsletters. And you can always email. Our emails are on the website. We want to hear from you. We want to know that we're doing what you think is the work we should do in the interest of the patients and the people who live in Washington State. This is about the health of Washington, as Sue said, it's not really about nursing. It's about the health of the people who live here. So I want to thank you all in distant corners of the state. Thank you all here and wish you safe driving. And thank Sue and Donna again. So thank you.